Hello there, this is Dr. Mintz. This is a CT abdomen and pelvis, and our focus today is going to be on the stomach. Ordinarily, we think of upper GI series as being superior and very helpful in the identification of abnormalities of the stomach, but we can see the stomach quite well on CT as well. Looking for things like ulcers would be difficult on CT, but we can assess the anatomy of the stomach quite reasonably, and in this case we have an abnormality which is a hiatal hernia. So starting, let's say, about here, we see bowel, and what is important in this regard is to be able to identify what parts of bowel you're looking at. So this is colon, and you can see some diverticula hanging off the side of the colon. So you know what that is, and you can follow, if you're in question, you could follow it to the left as the descending colon, and you also see stool-like material in it. So that's colon. Here's stomach, and as we go superiorly, we see what looks like the stomach to be coursing through the esophageal hiatus, which is the transition point between the esophagus and the stomach, ordinarily at least. In this case, the stomach, which is primarily below the level of the diaphragm, a portion of it, the most superior aspect, the most proximal portion of the stomach, has herniated through the diaphragmatic hiatus, the gap in the diaphragm, and we can see that gap in the diaphragm. So this is the hernia itself above the level of the diaphragm. We follow this down, we see the diaphragm on the left here, we see the diaphragm on the right here, and we see a gap between those two leaflets of the diaphragm. The aorta goes through that gap more posteriorly, and in this case, ordinarily the esophagus goes through that gap in the diaphragm, but in this case, the stomach has herniated superiorly through that hiatus, and now a portion of the stomach is above the level of the diaphragm. So this is the hiatal hernia, and this is the widened area. Let's see if we can get that right here. You can see the left hemidiaphragm and right hemidiaphragm have opened up. This should only be 1 or 1.5 centimeters here, and this is probably 2.5 to 3 centimeters. That has opened up and allowed the stomach to partially slide through superiorly into the retrocardiac area. So this is a typical hiatal hernia where we see an air-filled viscus in the retrocardiac region, consistent with a hiatal hernia. Here you follow the rest of the stomach more distally to the point where it becomes continuous with the duodenum, and we won't follow that, but you can see that we are near the pancreatic head. Here's the pancreatic head here. Here's the pancreatic neck and the body and the tail, which always goes right to the splenic hilum. So we can see the pancreas quite well here. Here's the gallbladder. Gallbladder has layering material in the dependent aspect consistent with stones. Here's the liver, of course, and the spleen. We have 2 large cysts of the left kidney, one of them so large that it's displacing the kidney anteriorly. The right kidney appears unremarkable. The abdominal aorta is normal in caliber. This is an unenhanced CT abdomen and pelvis, but still we can appreciate the aorta as distinct from the IVC. As we follow the IVC from below superiorly, we see it enter into the substance of the liver above which it courses to the right atrium. So this is a good example of a hiatal hernia. Let's look at it in another plane. Moving from posterior forward anteriorly. Right here you can see this diaphragm and this diaphragm, and you find this air-containing structure superior to the diaphragm, which is the hiatal hernia. And if you look closely, you can see that it is continuous with this portion of the stomach, the body of the stomach, inferior to the diaphragm, and it's herniating through what is referred to as the hiatus, the esophageal hiatus. So this is standard, typical garden variety hiatal hernia. What we also see here are a few diverticula, quite a few, of the transverse colon. Two large renal cysts on the left, and stones in the gallbladder. Moderate amount of stool in bowel. This case also illustrates how useful oral contrast can be, because here we don't have oral contrast. So distinguishing large bowel from small bowel, and even distinguishing bowel, such as here, this is a segment of the duodenum. So if we follow the stomach, here's the stomach here. We'll go up. Here's the hiatal hernia. We follow that inferiorly through the esophageal hiatus, through the defect in the diaphragm. Remember, this is the right hemidiaphragm. This is the left hemidiaphragm. Right hemidiaphragm. Right hemidiaphragm, left hemidiaphragm. It's that gap between those two that is the hiatus, and the aorta also passes through that region. And here you can see the esophageal, or rather here you can see the hernia above the level of the esophageal hiatus, and below the level we see stomach, and stomach continues distally as the duodenum, and the duodenum, the second portion of the duodenum, is right here. The first portion is immediately following where the stomach is visualized. Here's stomach, so that's the duodenal bulb, and that makes this the second portion of the duodenum, which is immediately adjacent to the pancreatic head, which is right here. Hard to see. Oral contrast would help. It would help distinguish small bowel, including duodenum, from pancreatic structures, but we can, knowing the anatomy, identify the second and third portion of the duodenum. This is the second portion, and the third portion would be coursing inferior to the pancreatic head here. Difficult to visualize well in this particular case. Here you can see the length of the pancreas here. Here's the pancreatic head, and as we look a little more superiorly, we follow the course of the pancreatic body all the way to the pancreatic tail, and the pancreatic tail always points right to the center of the splenic hilum. We see some layering stones in the dependent aspect of the gallbladder. Bowel is best visualized when you have good oral contrast and IV contrast opacification. Here we can see areas that look like they're stool filled and therefore consistent with colon. This looks like right colon. Let's see if we can find the terminal ileum coming into that. think it's coming in right here, but very hard to see well, and this would be optimized if we were to give oral contrast, and if we were to allow it to be in the system long enough to go all the way to the terminal ileum and define this region here of the terminal ileum and ileocecal valve region. Okay, let's look at this in the coronal plane, and here we can see this hollow viscus superior to the level of the diaphragm, consistent with a hiatal hernia, and we can see continuity of this structure with the portion of the stomach that's inferior to the diaphragm, and this is all stomach here. So we have stomach here, and immediately adjacent to it, inferior to it, is the transverse colon, and then inferior to that you see several loops of small bowel. Here's the right colon. This is the region of the ileocecal valve. You can appreciate that here. So that makes this cecum, and that means that we know the terminal ileum should be coming in somewhere around here. And don't see it real clearly here on these coronal images, but we know where it is. Probably right about in this area here, but it's hard to say for sure. So, a little bit about the hiatal hernia and a couple other interesting findings, and that's all for now.